September is Suicide Prevention Month. It's an opportunity for us to bring awareness that suicide is a very real and serious public health issue. There are about 38,000 suicides a year and almost 380,000 attempts. Throughout the month, we'll see a great deal of suicide awareness campaigns. And suicide cannot be reduced through awareness alone in public relations. Though these announcements may draw attention for all of us to pay attention, we must dig deeper in our understanding. Suicide is preventable and is often the result of untreated chronic depression. And depression is recognized as a medical condition. Suicide is tragic for the individual, the family, and the community. Many of the true mental illness-related suicides could be prevented if people with mental illness were provided adequate care. Suicide is not a selfish act. I know that because we as human beings, we seek intellectual closure. When we struggle to understand, we might rush to judgment. Naming suicide as an act of selfishness really doesn't give the complexity of traumatic emotions any justice. People struggling with thoughts of suicide are often an altered state of consciousness that really can't be explained simply by making it merely a decision of selfishness. Important to suicide prevention knowledge is the understanding of risk factors, which are dynamics that may increase the likelihood that someone will consider suicide. Warning signs, which are cues, be it behavioral or emotional, that indicate risk, and protective factors, which are characteristics that may make it less likely that someone will consider suicide. We also have to consider the relationship and the interaction between the three. Protective factors, these are the things that help me feel connected to the world and provide me a sense of purpose, as well as the skills to build and maintain resilience and strong emotional regulation. Many of the best protective factors are meaningful relationships, which is a human need. We need to feel connected to people. These are the people that help me feel valued, who are accessible to me, and who I feel safe with, who I know I can count on to help me meet my most basic physical, social, and emotional needs. This includes you, friends, family, healthcare providers, counselors, community support systems and organizations, your faith support system, and yes, even your employer. It's important, particularly for individuals at higher risk, to have regular contacts with their counselor and healthcare providers for intervention. I want to take some time to go through some of the risk factors, right, or things that may make suicide a higher level of risk. The biggest risk factor is a history of past suicidal attempts, followed by a history of suicide in the family. Second to that is substance abuse. So a history of abuse and misuse of drugs and alcohol also is a high risk factor. Mood disorders. So individuals who struggle with depression or bipolar disorder or anxiety. And most definitely an access to means to carry out suicide. Significant losses contribute as well. So the breakup of an important relationship, or maybe the loss or death of a loved one. Stress from trauma, bullying or discrimination, and chronic medical illness are all risk factors that increase the likelihood of someone carrying out or having thoughts of suicide. Some of the warning signs are things that you should pay attention to or recognize for us to intervene and support individuals who are struggling. Is someone feeling preoccupied with suicide, death, or dying? Perhaps there's indication of hopelessness and worthlessness, so people who feel like they have no other choice or their life has no meaning. A lack of purpose, no reason for living, or wanting to escape pain. So when we hear people say, I don't want to live like this anymore. Withdrawal from friends and family, from things that they once enjoyed, withdrawing from work. isolation, or feeling like they're a burden on other people. Recognizing suicide warning signs are important, and even more imperative is that we recognize and care when people are struggling long before they reach this point of hopelessness. So, to prevent and reduce risk of suicide, we want to strengthen our protective factors, reduce the risk factors, recognize the warning signs, and respond with compassion. What can you do if you recognize someone is struggling? One, we as a community and as a society need to commit to eliminating the stigma and talking about living with and treating mental illnesses. You could do this by contributing to making our home, our work, and our social environments emotional expression friendly. So in other words, I want the people around me to feel just as comfortable saying to me that they're having a bad day as they are saying to me they're having a great day. Ask people how they're doing and mean it. And make it okay to say more than "I'm fine." To identify emotions at a granular level. Most of the time when we say "I'm upset" at a granular level, that can mean so many things. Destigmatize and normalize the use of language like "I feel depressed," or "I'm scared," or "I'm hurting." If children, adolescents, and adults, if people aren't comfortable sharing these important emotional experiences with you, they most certainly will not come to you when they are the most vulnerable. Respond with the same level of compassion and concern to a person sharing their emotional pain as we would a person sharing their physical pain. "I feel depressed" should warrant the same "I'm concerned about you. That sounds serious. Have you talked to a professional about this?" Just as much as "I have a bad headache" or "I have a horrible tingling pain in my arm." And respond. We've created a culture of awkwardness around mental health. Out of our own discomfort, we may avoid warning signs, being unsure of what to do or say. When people are sharing their struggles with us, this is often their cry for help. Doing nothing can be more harm than good. So when you're unsure, ask, "What can I do to help?" And don't be afraid to be forthright and ask, "Have you had thoughts of suicide, or have you had thoughts of hurting yourself?" Talking about it and saying the words does not increase the risk. It actually has been shown and proven to be more helpful. If someone is at serious risk of harming themselves, please do not try to assess the seriousness on your own. Get them to emergency care right away. Connect them to a mental health professional, or connect them to your local community mental health organization. I also want to provide you the National Suicide Prevention Hotline, available all the time at 1-800-273-8255.